Hey, it's Dr. Troy here at Synaptic Chiropractic. I want to talk about disc bulges or disc herniations in the spine. So in between each vertebra, there's tiny shock absorbers, also known as the intervertebral disc. I look at them as sponges, and inside of those sponges, there's a jelly-like substance. So what can happen, though, is that jelly-like substance that's inside, kind of like an egg yolk, would push out into the egg white and maybe crack the shell. That's basically what a disc bulge or a disc herniation does. So if we look at the spine model, there's discs in between each vertebra. If the vertebra is out of alignment, or there's been trauma and misalignment, and then gravity has loaded that spine over time, the disc can actually degenerate, it can herniate and bulge, and then the problem is that can put pressure on the nerves that come off, put pressure on the spinal cord, and that can adversely affect things like muscle function, skin sensitivity, also known as paresthesia. You could get weakness, you could get loss of reflexes, and really the biggest thing that people come to see us for is they've lost their quality of life. They can't sit, they can't play with their kids, they can't go grocery shopping. They can't walk around the mall without excruciating back pain. Recently had a guy who's taken 8 Vicodin a day just to keep his pain level at a 6 out of 10, 10 being the worst. So what we do is we look to see where this disc bulge could be causing your problem. One of the best ways to really see it is with an MRI. And we have facilities that we work with that do great MRIs, send us great reports, and then we go over those with you and educate you on how do we correct the disc bulge. And really one of the big components with this thing is going to be loss of strength and loss of function in the posterior chain muscles of your spine, meaning the muscles in the back that hold you up from gravity. So there's a rehab protocol that goes along with the decompression, and that we've found has been very, very successful in alleviating people's pains, and really the key is getting their life back. So if you're suffering, you've been looking at surgery, you've had surgery, you've had shots, somebody said, hey, you've got bulging, maybe you're just going to do pain management, you've tried other forms of therapy. Let's see if spinal decompression, spinal traction is right for you. Schedule a consultation with us at our office, 360-260-6903. And what do you have to lose besides the pain that's limiting your quality of life? This is Dr. Troy at Synaptic Chiropractic.